our final MCubed difference presentation for today is Global Trade, Global Pollution, Global Health Impact, which includes a faculty member and graduate student from the School of Public Health, in addition to faculty from the School of Natural Resources and Environment and the College of Engineering. Joining forces are professors Olivier Joliet, Ming Zhu, and Steve Skurlas, with graduate student Katerina Stilianu.
So, good morning. So we'll finish this morning by a somewhat shocking but global problem looking at pollution, global impact, and trade. Question is, are we responsible also for the pollution not only here but in Asia? Fine particulate matter, we don't see them in our sky, are 2.5 micrometer particulates. It's about 1/50th of a hair as diameter, and they are there. They are produced by coal power plant, by wood heating, by traffic. They enter our lung, and they kill 100,000 people in US only every year. That's about every day a Malaysian airplane crash. Why don't we speak as much of that as from airplane crash? Because we don't realize what it is. 85% is cardiovascular disease, and we don't associate it unless we do epidemiological study with pollution. But we need to act. Now, this is in US. Think about a sunny day in Beijing. The pollution level are at least 10 times higher than here. And globally, worldwide, it's 3.2 million deaths every year. To give you an idea, since this morning, these are 4,200 deaths. These are 13 Malaysian airplane crash since this morning due to air pollution. This is huge. Now, Beijing, this is not our problem. But is it? I mean, this is a T-shirt that my son offered me when he started the university here. And this T-shirt, if you look at the label, has not been, in fact, produced here. It has been imported. And you see on this picture the size of the land, the country, is proportional to the import of clothing. US is the largest clothing import. Where are these clothing coming from? They are coming mainly from Asia. You see here China, India, Eastern Asia are really the highest producers. So are we responsible? Partly, surely. Because when I wear this T-shirt, it has been produced there and created pollution there. Now, how much? That was the question. If we want to quantify that, we need to quantify that people realize what's going on and can take action. Now, I'm at the Environmental Health Science at School of Public Health. I can model pollution, but I need someone to model trade. At that time, I was on sabbatical in Sydney, and I knew that I had a colleague here, so I took my phone and called my colleague Ming Zhu.
So when Olivier called me, I was actually in China, not in the US. And then we then emailed Steve, who was on a plane at that time somewhere in the US. So after a brief discussion, we all agreed that this is something worthwhile to study. And I remember that was last day, deadline day for MCubed to accept proposals. So in the morning, we start our conversation. In the evening, we submit our proposal. And the next day, we have an MCubed project. So soon after that, we brought in students from Cyprus, India, and China to work on this project. So we have a global team to work on a global problem. So we first look at the case study, laptop. So everybody has one, and a laptop sold in the US has its parts coming from all over the world. So we first use an economic model to characterize the global supply chain for an average laptop computer in the US. And then we use an atmosphere model to measure the particular matters generated at each stage of the supply chain, and also the human exposure to those particular matters. So with our model, we can tell what's the global health impact due to the consumption of laptop computers in the US. So our results show that actually 95% of the health impact actually happens outside the US, mostly in Asian countries where the computer parts are mostly produced. So this case study validates our hypothesis and also our approach. So next we look at the full global trade system, which includes trade flows between about 15,000 sectors from 187 countries. So with our model, we can tell what are the health impact due to particular matters induced or driven by the consumption of particular types of products in any given country.
So for the human health impact of our project, we estimate human exposure by using fractions of particulate matter emissions that are inhaled by the population in different regions of the world. For example, in the Detroit New Ann Arbor area, this fraction is 17 parts per million. And in New York City, it's 49 parts per million. However, in Asia, these estimates are much higher. We see that in Tokyo, it's 94 parts per million and can be up to 260 parts per million in India. In our analysis, we found some interesting results. This figure is a representation of the world's production per capita as a function of the world's population, telling the story of the world. We are comparing 3 consumers from 3 different regions: Asia, North America, and the rest of the world. Each consumer is represented by a column, and within each column, the colors correspond to the region of production required to satisfy the consumer's needs. As we can see, the North American consumer has the highest production per capita, with the majority of which is happening in North America. However, it is interesting to see that the North American consumer is inducing as much production in Asia, as we see in red, as an Asian consumer. Now, let's see at the same figure in terms of the health human impact. The red colored area in this figure is overwhelming. This means that Asia is experiencing the majority of the impact in terms of particulate matter-related deaths induced by consumption. However, the question still remains: are we, as North American consumers, responsible for what is happening in Asia? And the answer is yes. We found out that North American consumers are causing as many deaths in Asia as they are causing locally, and this is equivalent to 46,000 additional deaths per year in Asia that we are responsible for.
So the number 46,000 is worth pausing with, right? So we look at the student body population of the University of Michigan. It's roughly on that order. Lives lost each year due to North American consumption. Or maybe said a different way, if we look at the number of faculty, staff, and students here at the University of Michigan, our consumption patterns lead on average to about 11 deaths per year in Asia. It truly is staggering. So what can we do? We're Wolverines, right? Well, we can stop to reflect on our own consumption, and many of us are doing that. We can marvel at our blue skies on the right-hand side here, but then before we take that too far, we have to acknowledge what Olivier said, that 100,000 lives are cut short prematurely here in the United States each year due to breathing bad air, due to particulate matter. The National Academy of Sciences has estimated that the drag on our economy is at least $60 billion a year. So we have more work to do. As we think about renewable technologies to combat climate change, this will also have a very significant positive impact on the health of U.S. citizens. And then we can ask, what can countries abroad do? Well, we can ask whether the types of technologies we've applied here, not whiz-bang technologies, future technologies, but proven technologies, what can they do to help? Can they afford those technologies? Well, our estimates suggest that an investment on the order of between $2,000 to $20,000 will save a life in these developing nations without the pollution controls. That is a pretty good deal. When you stop and think about the cost of a sick person, the positive benefits of a healthy person, this is an excellent investment. So we can talk about choices. And certainly a woman walking down the street in one of the most polluted areas of the world doesn't have the choice to breathe clean air. And we can ask whether clean air should be a human right. We can ask about our consumption patterns. We can ask about the role of governments. But we would conclude by maybe asking about the role of companies. I spend a lot of time working with companies on their sustainability reports. And you'll see they have targets for energy consumption, targets for water consumption, targets for limiting greenhouse gases. But what about the targets to reduce particulate matter pollution? And if you ask him, why are you not considering it? Well, it's not that they don't know the gravity of the problem. As the counter says, since midnight, 4,300 deaths. And in the time of this presentation, about 63 deaths. They're aware of the gravity of the problem. What they'll tell you is they don't have models that would tell them if they change their sourcing of product, if they do things differently, what would be the reduction in mortality? Well, thanks to MCubed, and in particular this project, now we have those models. So what are the next steps? The next steps are not just to help them calculate carbon footprints, but to compute particulate matter footprints, to help them set meaningful targets for reduction, and to help them achieve them in the most cost-effective ways. As Ming mentioned, we never would have met and gone down this road without the MCubed project, so we're very grateful for the support and thankful for the opportunity to share our findings so far with you. Thank you.